lawmakers in Washington, D.C. prepare to do away with the Affordable Care Act, there's a lot of uncertainty surrounding what health care coverage will look like here in Tennessee. News Channel 11's Allie Hines talked with local lawmakers who say this year may be the time to expand health coverage in Tennessee.
Good morning, Anna. Here at hospitals like Johnson City Medical Center, Mountain States Health Alliance spends millions of dollars each year in charity care for people who can't afford insurance. And thousands of people here in the Tri-Cities fall into a gap. They make too much to qualify for Medicaid, but not enough to be able to afford insurance on their own. Expanding Medicaid here in Tennessee, the hope is it would close that gap. But just how to do that is what lawmakers are still wrestling with.
There is a gap of people who are uninsured. How do you fill that gap?
The latest proposed plan to answer that question in Tennessee was Governor Bill Haslam's Insure Tennessee, a plan shot down by other lawmakers refusing to accept federal dollars for Medicaid expansion.
What our concern, I think, has been on the state level is how do you not create this huge tax that everybody else is going to have to pay? Because those were the strings that were attached from D.C.
Now, President-elect Donald Trump is preparing to enter the White House.
I think he's going to give a lot more power back to the states, and by that happening, it will give us a lot more opportunity to see what we need to do to move Tennessee forward.
One possible way of giving the states more power, block grants, which would be blocks of money from the federal government, giving the states freedom on how to spend it.
The things that I have read, I've heard from not only the incoming Trump administration, but I've heard from Congressman Rowe, is formulating that in block grants, which is what we talked about years ago. If we could do that, and without strings have the ability to spend the money, that's the way to do this. And if that's what comes down the pike, I think we're going the right way.
Senator John Lundberg says for this reason he sees more hope now than ever of Tennessee accepting money from the federal government for Medicaid expansion. But State Representative Timothy Hill says with that power also comes a heavy burden for the state.
We're going to be in charge of our own fate, and that's good on one hand because we get to have the control of it at the state level, but it's also a tremendous responsibility because we have to do it and do it well, because there's nothing holding us back.
Lundberg says he sees block grants as a bridge but not a permanent solution. Governor Haslam's Insure Tennessee proposal, he says, would have covered about 280,000 uninsured Tennesseans. And Haslam said last year until a new president is in the White House, he won't be introducing any kind of bill like this. Reporting live in Johnson City, Allie Hines, News Channel 11 in your corner.